All right. Am I live? I think I am. Yes. Hello everyone. And so you know what time it is. It's disclaimer time. The views and opinions expressed in this podcast are those of their host and their guests and do not necessarily reflect the official policy or position of any institution, nor is an endorsement of any agency or organization. Any views or opinions are not intended to malign any religion, ethnic group, club, organization, company, or individuals, and we respect the fact that people's views and opinions are subject to change. So, welcome back to another week and the seventh episode of Talk Public Health. If you are joining us live on YouTube or you're listening to a recording of this episode, we're glad to have you back. I'm flying solo today, but just as always, I'm joined by my co-host, Naomi. Okay. Are we are we live again? Hey folks, if I am live, just let me know. I'm trying to see, having a bit of technical difficulties. Let me see. Hold on. Am I live? Okay, yes. Sorry about that. I was just, anyway, it's all good. Let's go back to the beginning then. um, so, as I said, next week, Naomi and I will be on the same screen, June 15th. That will be really exciting. And before we begin, you know the drill. For those of you joining the show live on YouTube, please hit the subscribe button and click the notification bell so that you're aware of where we upload new content. And follow our social media channels. They're all in the descriptions, in the description section of this video. It's always interesting trying to do a topic like this. Um, Flying solo, it's a bit different, but I'm really looking forward to the opportunity to talk to you about the topic of knowledge translation and communication in public health. Um, I guess that this topic is really timely because myself, other friends of mine in the Europop Health program, and those who are working in academia and are concluding like there are masters or a PhD theses and defenses are trying to figure out does our work, what does our research actually mean for bringing about action in the public health field. So I guess that this kind of brings us forward to like the first question to kind of want to address, which is exactly what is knowledge translation. And the WHO does a good job at giving this a definition. They define knowledge translation as the synthesis, exchange, and application of knowledge by relevant stakeholders to accelerate the benefits of global and local innovation in strengthening health systems and improving people's health. Okay, what does that mean in a bit more practical terms? Knowledge that is derived from research and experience will be of little value unless it can be placed into practice. And ensuring that research and evidence in different areas of public health, whether that's health systems management, policy, health decision making, it's an important challenge for this century and for our current time, with knowledge translation emerging as this new paradigm shift to be able to address this challenge between closing the gap between the know and the do. What do I mean by this? We know that tobacco kills, but how do we create policies that are effective and actually protect persons from use and exposure to tobacco? We know that alcohol is connected to a lot of social harms, but how do we ensure that we implement policies and initiatives and practices that will protect the population and those who are dealing with challenges related to alcohol addiction and whatnot? We know that climate change is real and that it is creating a host of public health impacts. But what are we doing to ensure that we're incorporating strong and effective mitigation and adaptation strategies to address these public health challenges? And so, really, right now, there's a need. This whole issue of knowledge translation has really been driven around this whole issue of the political class. Um, political politicians have put in imperatives to ensure that there's increased accountability in the utilization of resources. And often than not, this simply means that, hey, the people are telling me that we're spending too much money on a lot of programs, on a lot of initiatives, and I want to make sure that what we're doing is actually backed by evidence. That would be what an appropriate policymaker would do in trying to carry out these type of actions. Um, but I guess that the main issue right now is that the health sector has had to adapt, right? Where we move from this model in which researchers are just simply disseminating information and knowledge to one another, to actually making an attempt to translate and exchange information, right, and knowledge to ensure that evidence-based or evidence-informed public health is being carried out. And even though this has been going on for a while, right, and it's become such an important topic, the issue really has been, if this is what's going on currently, why does there continue to be a gap between what public research is being put out and what policy actions and decisions are actually being taken? And I guess that in trying to address or tackle this complex issue, I kind of wanted to look at it from three different areas. There's the gap between the policymakers, there's the gap between the media, and then there is the gap between public health practitioners themselves. So I guess beginning to talk about the gap between public health researchers and policymakers, there's this whole issue in trying to the complexities that go around creating and sharing, sharing, and accessing evidence for public health research. So you want to carry out evidence-based research to inform public health policy decision making, but there doesn't appear to be the access to human resources or the capital that's needed to carry out these projects, because sometimes they have to be carried over for a long period of time. They could be months, they could be years. They require persons who may have knowledge in the field, and those persons come with a particular price tag. And then you also have this issue where you may have been commissioned to carry out certain work, or you may be trying to contribute towards addressing a public health issue, but there seems to be an issue in terms of openness and willingness to share information between government agencies or researchers. And this is not at all confined to a global north versus global south like paradigm. I remember talking with some researchers in Sheffield about this whole issue of trying to access information to carry out research for the NHS, and how you could be an NHS employee and even carrying out information and a research project for an NHS group, but still have a lot of difficulty accessing information between different hospitals and different practices that are operating within the NHS. And this creates an issue in terms of how can this research actually gather up enough evidence for you to present to a policymaker to say, okay, here's the actual trends that we see. Here's what we've actually determined. We have some issues with data collection, but we think that this is the best decision we can make with the evidence that we have before us. Then there's also the issue in terms of contextualizing information if you're moving from different contexts. So I can speak from the Bahamas context, or from a global south context, in which you have a lot of times politicians or policymakers or whatever group, right? It could be a civil society group or whatnot, that bring in expertise or information from a different context. But in trying to contextualize that particular information, it ends up falling a bit flat, right? In terms of whether it's in terms of changing. I'm trying to find the right way to like say this. Whether it's addressing issues around like universal health coverage, and whether the type of options that are being presented, is it something that can be adequately translated into a Bahamas context, or perhaps it's in terms of strategies that are being undertaken to maybe increase breastfeeding within a certain area. I've seen this clash between like the global north and the global south, and how these topics are actually addressed. And then the other issue that we also seem to have is people not really understanding what the political capital or the political window that's available to actually carry out these type of processes. So let's talk about like the Overton window. This is when like certain discourses or certain things are considered acceptable. So in the global context, there's a lot of drive towards pushing for universal health coverage, trying to close the gap to ensure that like no one's being left behind, trying to like push towards initiatives to try and increase minimum wage, put forward living wages. And the question is whether or not that particular global initiative is actually being it's actually something that your country's politicians are actually interested in. Um, and sometimes this kind of falls on the other side. Is it because that something is acceptable at this time that we're ignoring other issues that need to be addressed in the context of a popular topic? So you want to look at putting forward universal health coverage, but are you also working on improving your social safety nets? How can you look at trying to expand your like health security and your health insurance initiatives, but you're cutting access that people may have to welfare or to social insurance benefits? A prime example of this is being seen within the UK, in which you see governments demanding for the NHS to do more because of commitments that have been made globally, but you're seeing a lot of cuts being done in terms of welfare services and whatnot. And this is being seen across different countries. And so I remember someone giving this interesting dialogue about when they went into a policymakers meeting, and they had at this point high level ministers, prime ministers, ministers of government, and they had this amazing slide deck with such amazing information being presented. And I'm trying to really keep it censored because I want to respect this person's privacy. But they had ended up telling colleagues that, you know, that we're never going to get past this first slide, right? If you want this particular group of politicians to act, you need to put everything in as simple terms on your very first slide. Otherwise, you're going to get bogged down. And when it's time to get to key actions, we're never going to get to that point. And they didn't believe it. And when they went into the meeting, that's exactly what happened. They got bogged down into some of the specifics, really nitty gritty parts of different parts of the slides. And by the time it came around to trying to address the key action items and the key deliverables for this particular project, they never really got around it. They had to schedule another meeting. And so this is really about trying to understand, like, what is the political context in which you're operating in? What are the priorities for the people operating at the time? And even though you have amazing evidence in your mind, is it something that the policymakers can understand and can see as something that can help them in achieving some of their priorities? The second bit is about the media. And I believe that this is something that like I really have a that I really enjoy talking about, because Often than not, we see where public health research it's put out, and then you see a article or a news snippet about some public health study that was done. Let's say maybe it's about drinking more wine will help to improve your like cardiovascular health, right? And to people who enjoy that, they're like, yes, okay, public health is telling me that I can drink more wine, and so that's going to help my heart health to be effective. But the reality is that it's talking about in moderation, and it's talking about a certain amount. And so I had an interesting debate that turned a bit heated with some public health practitioners in recent times, like probably 3 or 4 weeks ago, about whether or not it's a responsibility of public health agencies and researchers to provide media ready talking points, media ready key messages for disseminating their research to the general public. And persons told me no. They said that it's a responsibility of the media to reach out to those who carry out this information, because as public health practitioners, they can't do everything. They can't be the media persons, and they can't be the researchers as well. And I completely disagree with them. I understand that we can't be all things to all people, but I think that there's a bit of a ethical. I believe it's unethical to put out research without trying to also put in messages that will make it easy and easy for the public to disseminate, to easy for the media to disseminate to the public, and for the public to become aware and to understand exactly what are you trying to communicate through your public health research. And so this was about, I was talking about the issues of like climate change and health impacts, and we were talking about vaccines and how this growing anti-vax trend is going on. And I said that, don't you think that it's important that we have more persons within these public health agencies that are also trained in the area of communication, so that when we translate our health research and data, the media can understand. And so there's this big like push between, no, that's not my role, that's the media's role. And there's also this thing of being fearful about entering the public domain, because persons feel as though people will perceive their research as being driven by a certain political agenda, or fear of victimization, or fear of just messing up. Like I talk with you, I talk with you, and Naomi and I talk with you every other week. And it is scary to be talking to persons who we can't see, and hearing ourselves when we see the videos go on. But that can't be something that keeps us back. We need to figure out how can we close that gap. And what I absolutely loved about what I managed to do in my undergraduate career was we had this course taught by a person who I consider a mentor, biomedical communications. And it was about how do you translate all of this research that we're doing into something that policymakers, the media, and researchers can understand. And I think that within public health schools, this should be something that should be prioritized as a course for anybody who's moving into the field of public health research or conducting any type of work that's going to mean translation into the general public. And then this last bit about the clash between translating knowledge and information to public health practitioners, and this tension between global and local health research. Um, yes, there are global standards, but those who work on the ground often than not have a good idea of the pulse of what people are feeling. And that's not to say that persons who are local practitioners have more clout and those who are coming in from a global perspective. But we need to find a way to be able to better harmonize those persons who are working on a global level, on a regional level, and those who are working on a local level. How can we ensure that we're both talking the same language, that we're both talking the same page? How do we ensure that the big key messages, the big key outputs can then be translated into something that's done at a local level? Whether that's around breastfeeding, whether that's around vaccines, whether that's around like climate change and health initiatives. What is it that you're missing? You want to help to improve breastfeeding at a particular context, but persons don't have access to food. People don't have access to adequate jobs, so they have to work more. Or there's religious or socioeconomic factors that are impacting this. I think that it's important that we understand this and not just try to blame and say, well, what you guys are doing is wrong, therefore follow the global guidance around this. No, I think that's how we end up having this pushback and therefore not seeing initiatives that we put money into not occur in a very effective way. And this is why we need to look at contextualizing strategies within low and middle income countries, or in the global north, the global south perspectives. And I think that a lot of this also means, how do we ensure that we incorporate people like civil society groups and non-governmental organizations who see a lot of marginalized persons, who help to kind of close the gap in what governments are doing and what academia is doing to actual practice on the ground. So I don't know. I feel as though like this whole issue of like knowledge translation and communication, it is a difficult topic, because even now we have difficulty, and like I'm having difficulty trying to think from my dissertation what type of action will actually be driven from my review of climate change, public health adaptation practices in the Caribbean. When I sometimes feel as though climate change and health isn't really a priority globally, even though it's growing. But in terms of other areas of climate action, it sometimes it's often being left behind. And I'm trying to think to myself, and I'm sure that a lot of people who I've talked to, they've expressed concerns to me about what I'm doing. It feels a bit abstract. What I'm doing, it feels as though it's going to help to get me some papers published, but I don't know if it's going to actually help to drive change within our countries. And I think that I really just want to encourage persons who are doing public health research to really look at, what can I do to ensure that I understand the political economy of the context in which I want to practice or apply my research to? How can I better ensure that persons who are in media, whether that's traditional or digital media, can understand what I'm doing and get feedback to try and improve that? And what can I do to ensure that other persons who may not be in my field of study can understand the importance of my research? And how can I better ensure that I can understand the importance of their research, and how we can collaborate to address these health issues? So I want to end on that note, because I know that we lost about 4 minutes from losing signal. So I just want to encourage people out there, while you're going through a lot of difficult times and a lot of challenges, to be kind to people, because you, me, everyone around us here on this planet, we're all that we have. So show some empathy and be kind to one another. Take care, and I'm looking forward to another episode of Talk Public Health.